you every Monday at 1:05 p.m. for Your Health Matters.
To the program. I'm your host, Rehanna Ramsay, and joining us today via Zoom is Dr. Arifa Aladdin, a pediatrician specializing in kidney disease, nephrology, who is currently in Alberta, Canada. Good afternoon, Dr. Aladdin, and welcome to the program. Before she comes on, I would just like to say that she will be talking to us about kidney diseases, its causes, its treatment, and the support systems we have available. Dr. Aladdin is also the vice chair of the recently resuscitated Kidney Foundation of Guyana, a nonprofit which helps persons suffering from the disease. Dr. Aladdin, you're on live. You can tell the listeners and the viewers online about yourself, and then we'll get into our discussion.
Good afternoon, Ms. Ramsey, and good afternoon to Guyana and the wider world in whatever time zone you were joining us from. Thank you for having me on today. I'd like to say thank you to Kaieteur News Radio for reaching out to us and for offering me the opportunity to talk to you today about kidney disease. As our host mentioned, I'm a pediatrician who's specializing in kidney disease and hope that we can use the foundation as a platform to promote awareness about kidney disease and to help persons who are affected by kidney disease. I hope that by the end of this talk today that I'll be able to enlighten some of our listeners about kidney diseases and the resources that are available. And if any one of you have any questions or any further comments or ideas or want to volunteer or join us, please check out our Facebook page and you can leave us a message. Thank you.
Okay. So before we go on with our discussion, do you just explain to the listeners what is nephrology, because that's a big term. People are not really aware of what that is. Sorry.
Okay, thank you. And so it's my pleasure to talk to you today about nephrology, as that's what I'm specializing in. And nephrology comes from the word nephron, and nephron means like kidney, the filter of the kidney or the working organism in the kidney itself. And so a nephrologist is a person who specializes in kidney diseases. And we know the kidney doesn't function by itself. It needs blood vessels, and after the kidney filters the urine, it sends it to the bladder where we pass it out as urine. So that collectively is called the urinary system, and we also study the urinary system as well. So a kidney specialist is a nephrologist who study the kidney and the urinary system, in short.
In short. We are talking about kidney diseases, and this is ahead of World Kidney Day. You touched on what the kidney is and how it's connected and why it's important. Um, in terms of kidney diseases, what are some of the likely signs that we need to look for, early signs, um, when somebody may be at risk of.
Okay. And thank you for asking me that. Before we go into what are the signs of kidney disease, I'd like to say what exactly is kidney disease. So we have any disease that affects the kidney or the urinary system. It's usually classified as kidney disease. But kidney disease is more than that. It's divided into acute based on the time and chronic. So chronic kidney disease, which we focus mainly on in the Kidney Foundation and worldwide, affects about 10% of the world population. We're talking about 700 million people worldwide have chronic kidney disease. And that is a big number. And the WHO has said that, that we're focused on non-communicable disease. And we talk about the tri-pandemic where we talk about the pandemic that we're in, which is COVID. We talk about chronic diseases when we talk about hypertension and diabetes and kidney disease and cardiovascular disease. And then we talk about climate change. And we can't really separate these things from each other. They're all interrelated. And so kidney disease affecting 10% of the world population is a big number. COVID has affected about 130 million people. Kidney disease currently has 700 million people, just to put things into perspective. COVID has killed about 1.5 to 2 million people already. Kidney disease has killed about 2.5 million people a year.
Wow.
So it is big and it needs to be highlighted. We need to educate our population on the impact of kidney diseases. Chronic kidney diseases, it's classified as chronic if you have it for more than 3 months.
Mm-hmm.
The reason we separate these two is because acute injury to the kidney can heal and it can get better. And then sometimes it progresses. And if it progresses for more than 3 months, then we call it chronic kidney disease. Now, if you have an acute injury, if you have some infection to the kidney or some insult, like a medication could have caused some damage, it may resolve, but you are more at risk for developing a chronic disease because there may have been some damage there. And later on, if you develop diabetes and high blood pressure, your kidney can be affected faster and more aggressively than a person who did not have an acute kidney injury.
So there are 5 stages, I understand.
Correct. So there are 5 stages of kidney injury, and chronic kidney disease is defined basically as kidney disease present for more than 3 months that affects the structure of the kidney, the function of the kidney, and it has implications for life. And so to just enlighten further on that, so any disease that affects the structure, meaning the physical appearance of the kidney, like you can have cysts in the kidneys and you can have tumors in the kidney, or you can be born with some abnormality or malformation in the kidney that affects the structure. Your kidney can function fine for now, but if your structure is damaged, you are set to have chronic kidney disease. Now, when we talk about the function of the kidney's function is to filter the blood. And so what it does, it cleans the blood, it removes toxins. Every day we eat, and most of us eat more than we're supposed to eat. We eat more proteins than we're supposed to eat. Your body, you're supposed to eat about 1 to maximum 2 grams per kilogram of protein per day. Protein produces a lot of acids, and it burdens the kidney to excrete all of the urea and the acid. And saying 50 grams in an adult of protein, it's less than 1/4 of a pound. And we know we eat that in 1 meal times 3 meals, right? Yes. So you can imagine how much the kidney needs to work to get rid of all of this. The kidney filters about 180 liters of blood. And that is a lot of blood that goes to the kidney. And so it constantly needs energy and it is filtering nonstop. It also regulates the amount of water you have in your body. And it also regulates electrolytes, your sodium, your potassium, your calcium, your phosphate. The kidney fine-tunes the entire body. And that's why it is so important. In addition to all of that, the kidney also produces hormones that are very important for us. The kidney produces hormones called erythropoietin, which maintains your blood count. And patients who have chronic kidney disease who are on dialysis would know that they need this injection maybe once a week to once a month to help boost your blood count because your kidney no longer can do that. It also helps to activate your vitamin D. And so patients with chronic kidney disease also has vitamin D deficiency and has bone disease because they are no longer able to maintain their bones in that way and they can fracture easily. So those are all things that the kidney does. In addition to all of that, the kidney is very important in blood pressure regulation. So it's a chicken and egg. If you have high blood pressure, you damage your kidney. But if your kidney is also damaged, you will develop high blood pressure.
Okay. You give us a mouthful about what are some of how the kidney functions and the 5 stages. You talk a bit about
I haven't
that.
actually gone into the 5 stages, so I'll go ahead, but then I'll go into that.
Well, you give us a mouthful about the functions of the kidney. So persons who didn't know, now you know that the kidney is so important. All of these things are connected. In terms of causes, you mentioned earlier that it falls on the NCDs. And then you said that if somebody uses a certain type of medication, it can damage the kidney. Could you speak to the risk factors?
Sure. And before I do that, I'll just go into the stages. So you did ask me about the 5 stages of kidney diseases. And so kidney disease staging is classified based on something called GFR. And I want our public to understand how we stage kidney disease and how we diagnose it. So when I mentioned that in the definition, it has the word function. Function is based on your glomerular filtration. So your kidney has nephrons or filtering units, and we're born with about 1 million of these units in each kidney. And with these filters, you are not able to produce more as you live. So when your filters damage, they damage. You don't get new filters. So your maximum number of filters are at birth. So when we talk about your kidney function, we talk about your ability to filter, and that's your glomerular filtration rate. And so the staging of kidney disease is based on your filtration. So if you're 100% working properly, your glomerular filtration rate is between 90 to 120. And with each staging, your GFR drops. And this is calculated based on your creatinine. So when people do blood tests, they do something called your creatinine. And then you use your creatinine based on ethnicity, height, and sex. There is a formula that you put that into, and it will tell you your GFR. And that will tell you your stage. And so it starts with stage 1, and stage 5 is end stage kidney disease, where your GFR is less than 15, and at that time you need dialysis or transplant. As your GFR declines, it's an inverse relationship between creatinine and GFR. So as your creatinine increases, your GFR drops. So your creatinine is like a marker, we call, of kidney disease. So you see it in your blood, it increases, and when you do the calculation, it's reciprocal.
Okay.
And then, so that is how we stage it. And we also check for another thing called protein in the urine, which is very important. And protein in the urine is part of the staging as well. So we stage based on your GFR and based on your protein in the urine. You also asked me to talk about risk factors or how we get chronic kidney diseases. So
or kidney disease in general, because
right. So in terms of risk factors, there are some risk factors that we call modifiable and non-modifiable risk factors. So in terms of the non-modifiable risk factors, we are born with some predisposition to kidney diseases. Sometimes we have a genetic predisposition. Sometimes when we're developing in the embryo, something went wrong and there's a mutation that leads to us being born with something that affects our filter or affects the blood supply to the kidney or affects the development itself. And we have like things like polycystic kidney disease or any of the cysts in the kidneys. We have a lot of what we call genetic glomerulopathies, even nephrotic syndrome. Now we have found genes that are implicated in this, things that we thought were just environmental or you would acquire. We're now finding more and more. The more we test, the more we find. And up to 30% of childhood kidney diseases are inherited now and are due to mutations. And as technology continues to advance, the things that we think were just by chance are now being linked to genes. And I must mention here, like now there's a big study out there that shows that Africans or people of African background are more prone to kidney diseases because they have a gene called APOL1. And so even when they develop kidney disease, it's more aggressive, it's harder to treat, And we have to take all of these into consideration. So when we see somebody who's an African descent who has really bad blood pressure and is getting rapid kidney disease progression, it's not just because of their lifestyle, which we would have labeled back in the days to say, okay, maybe you're in the Caribbean, it's the Caribbean lifestyle that we thought was the risk factor. But no, they have found a gene now, and to say, well, 70% of the people who are Africans who are going for transplant, when we work them up, this mutation is there.
Wow.
And we have to be cognizant of that. Then there are other risk factors. So we talked about genetic, and then we talk about environmental risk factors as well. So, and this is the same across categories for chronic diseases. So obesity is one of the chronic risk factors. Obesity causes you to overwork every organ of your body. The kidney is no exception to that. So the kidney is going to need to work more to filter all of that blood you have and all of that waste product that your body generates, because you have more mass in your body. We have lack of exercise will lead to that. High blood pressure, diabetes, those are our two main chronic diseases that will cause kidney diseases. Urinary tract infections recurrent urinary tract infections can cause kidney disease. Every time you have a urinary tract infection, that infection can scar your kidney and damage it. And as I mentioned, the kidney doesn't regenerate. You don't get new cells. It's like the heart. Once it's damaged, it's damaged. There are medications out there that can also damage the kidney. So NSAIDs are a group of pain medications out there, like ibuprofen, can cause kidney damage as well. So if we overuse certain medications, there are certain antibiotics as well that can damage the kidney. Some of them we can predict when we use them how much, and there are some reactions that we cannot predict their damage. So we should only use medications when we need to use medications and when it's prescribed appropriately, and we can measure the effects and we can warn our patients to look out for side effects. There are other things like viruses, even COVID can damage the kidney as well. And we found that up to 30% of hospitalized patients had a kidney injury with the COVID infection. So risk factors are divided into genetic, environmental, and then we have epigenetics, where you're born with the predisposition, but you don't develop it until you get like a secondary infection or another hit, which is called like a multi-hit.
Wow.
So there are many, many risk factors that affect the kidney.
So you touched on our diet. Could you simplify? Because we have a lot of protein. We consume a lot of protein in this part of the world. Can you simplify, like what rice? I know rice, a lot of meats we use is,
Yes, and so we use more meat than we should be using. We use more protein than we should be. We use more of everything than we should be using, except for fruits and vegetables. So our kidneys don't like too much protein because protein generates acid, it generates urea, and we need to get rid of it. It needs to work harder. We also use too much salt and too much sugar. And salt causes high blood pressure, and high blood pressure damages the kidney. In addition, salt itself is toxic to the kidney, sodium. And we're supposed to just use about 5 grams, which is a teaspoon of salt in a whole day. We cook with that in one meal, and then we sprinkle some more salt. And so salt is bad for our kidney. We need salt to grow, and we need some salt in our body, but too much of everything is bad. Sugar is also not good for our body, and we know that we only need to consume enough to give us energy, and simple sugars are the worst. We will get sugar from our rice and our carbs, and we know that about 40 to 60% of your plate should be carbohydrates, but it should be complex carbohydrate, not simple sugars, not your breads and your baked goods. But if you want to have carbs, you have your complex carbohydrates. And those are better because it takes longer to burn. Sugar in your body actually increases the work of the kidney as well.
In terms of measuring, like when every disease comes with symptoms. So how do you know? What are some of the things that would show up? Is there pain in the abdomen? Is there vomiting? How do you know that, okay, it might be something is wrong with my kidney or something like that? How do you know? And what tests do we have available that would diagnose this sort of problem?
And that's an excellent question because sadly, we don't usually know when we develop kidney disease. You will be perfectly fine for the most part until you have lost about 50% of your kidney function, until your kidney is already 50% gone. Then you may have high blood pressure. You do not really show symptoms until you are stage 3 going on to stage 4.
Wow.
And that's why most people who are diagnosed with kidney disease is diagnosed late, too late sometimes. And that is why it's important to do health checkups. And we need to identify those people who are at risk for kidney disease, and we need to intervene then before they actually develop kidney diseases. So our patients who are listening, those and for our population, people who are hypertensive, people who are diabetic, they need to check their urines for protein at least once a year. They need to check their blood. You need to check your kidney function, we call it, which is your blood urea nitrogen and your creatinine. And we may not see these numbers being abnormal, which is something that I want to emphasize as well. You might do your kidney function and you might see your creatinine is 1 this year, and then next year it might be 1.2, and the other year 1.4. But these all fall within the normal limit, but there's a trend that it's increasing. And so we need to clue in on trends and numbers and not absolute numbers. And this is for our healthcare professionals as well, because when it's abnormal, you look and you see a range and say, okay, it's abnormal, let's do something now. But no, let's do something before it becomes abnormal. Let's look at the trend and start to say, okay, your kidney function is progressively getting a little bit worse each year. We need to see what we can do to stop that. How do we slow the progression of kidney diseases? Where is this injury coming from? Is your sugar under control? Is your pressure under control? Are you taking any medications that can damage your kidney? Do you have a urinary tract infection? Are you exercising? Are you putting on too much weight? Let's stop these things before, because you will not have symptoms.
I see. Can the disease be cured? Is it possible that you can be free, have the disease and get treatment and have a regenerated kidney, I don't know, of some sort?
Okay, yeah, and that's a good question again. So kidney disease is an umbrella term. It's very broad, and it involves a lot of other little diseases in that category. So for instance, kidney diseases can be cured. We have children who have nephrotic syndrome, and a lot of nephrotic syndromes can be cured. So they are curable kidney diseases. So it doesn't mean that, you have it and you cannot be cured. And it depends on the cause of it. So when you are diagnosed with kidney disease, you need to know what caused it. So if you know what caused, some causes can be cured. Some, no matter what you do, will progress. And like some of the kidney disease that you're born with, like your polycystic kidney disease, you may not be able to slow the progression, and they will go to end stage kidney disease in many, many instances. But some patients who reach end stage kidney disease can be cured with a transplant. So some genetic diseases don't usually recur in a transplanted patient.
We're going to go to a short break in a few, but before we go to break, we know that we have, you're part of a foundation that offers support for kidney patients, kidney disease patients. What are some of the other support? How can we support persons who are going through this sort of thing? What would you recommend?
Okay, so supporting someone who's going through this kidney disease is very, very important. We tend to not think that mental health and physical support and emotional support, financial support is so important. And we, as healthcare professionals, sometimes focus on just the disease and trying to fix the disease and help the patient in that way. But we need a collaborative and a collective effort. We need a multidisciplinary approach to supporting chronic kidney disease. It takes a toll on family members. We all know somebody, or we all have family members who have diabetes and high blood pressures. And a lot of us in the Kidney Foundation of Guyana have had personal encounters or family member who's been on dialysis or who have had transplants. And we know the toll that it takes. So what we are hoping to bring out of this awareness is to advocate for support, to know that the family, some patients who are affected cannot work anymore. They're always on dialysis. When they're on dialysis, they're tired. When they go home, they're tired. They rest for one day, they come back, and that's their life. But and what I want to emphasize as well is that the World Kidney Day team this year is living well with chronic kidney disease. And you know what it did this year? It focused entirely on patient empowerment and patient support, and how we as healthcare professionals and as policy makers and health advocates can help these patients. We need to empower them. We need to let them live while they're alive, basically. We need to give them that support. We need to let them know that they can eat healthy, that they can be able to do things, that we can have a nutritionist to advise them, that we can have a pharmacist to sit down and say, well, these are the medications you should be taking. We need to let them understand their diseases. We need to let them know their options. Are you a candidate for dialysis? Do you even want to do dialysis? If not, do you want to do transplant? How can we help you through these choices? How can we be there to help you understand what's happening?
Okay, Dr. Aladdin, we'll go to a quick break now. And when we return, we will have more on the discussion about kidney diseases and how the treatment options and how we can offer support to patients.
Kaieteur Radio, keeping you informed.
Demerara and Essequibo 99.1 FM.
Burby's 99.5 FM. Kaieteur Radio.
Welcome back to the program. We're talking with Dr. Arifa Aladdin, a pediatrician specializing in nephrology, which is kidney diseases, the study of kidney diseases. And she's telling us more, talking to us about how we can offer support to persons with the disease and how we can, the kind of treatment options that are available. So, Dr. Aladdin, before we went to break, we were talking about how the kidney functions, some of the risk factors, and so on. And you are a pediatrician, so I would love for you to touch on how early the early stages and how children are treated in terms of those who are diagnosed with the disease.
And thank you for allowing me to touch as a pediatrician on this important aspect of my training and specialty. Kidney diseases in children sadly are not diagnosed early enough in most cases. We have children that are born with kidney disease. Say 1 in every 400 to 600 child may be born with the kidney disease. And we have this group of kidney disease called Kaieteur, which is congenital anomalies of the kidney and the urinary tract. In the developed world, most of these conditions are identified during screening ultrasounds done in pregnancy. We know a lot of our people in Guyana and in the developing world that don't have access to these technology and may not be doing all of their ultrasounds. So we miss a lot of the kidney diseases. And what happens is that most of the congenital kidney diseases will present when the patient becomes very sick. Or some of them that are slowly progressive will present in adulthood. And so when you have a young adult diagnosed with chronic kidney disease, you need to look back and say, well, clearly this may have developed during childhood. It's something that would have been missed at some point. And so we need to be vigilant as healthcare professionals to when we're seeing patients in health centers and in clinics and doing vaccines, there are simple things that could clue us into kidney diseases or any disease for that matter. And one of the most important things is looking at their growth. So your weight and your height are linked when you go to your clinics to get vaccines. Like parents, when you take your kids, when they give you a growth chart, you have to look at it and there are lines and you need to know, is my child growing normally? If they're not and they're falling off of their growth chart, as we would say, or below their growth percentile, we need to say why. Are they eating and drinking well? Is something else going on that we're not finding? And if we can't find anything, then we need to work that child up, because chronic kidney disease may just present as growth failure or poor growth. They may not be tolerating their food, or they may have high blood pressure. And not often enough do we check blood pressure in children and do it properly. Because children are very fussy, they fight, and then blood pressure cuffs are different for each size of patient. And we may not always have, like in the primary healthcare system, the number of cups that we need and the sizes of it to test. So if we check their blood pressure, if we check their growth parameters and we find something is abnormal, or if they're complaining of pain, if they're not passing urine or they're still bedwetting after 10 years old or 7 or 8, and they're having recurrent urinary tract infections, or they're having an infection once a year, we need to work them up. Do an ultrasound, check their urine, do a basic blood work.
In terms of the support and treatment, you are part of the Kidney Foundation of Guyana, but what else is available to persons here? Where can we go if we have an issue with our kidneys?
Okay, so first of all, we have like the public health system. We have primary health care in Guyana. So we have our health centers, and most people have access to a health center in their area. You go to your health center, you see your doctor, you check your blood sugar, your pressure, and they can do a urine test as well. You can do a dipstick to see if there's protein in the urine. Once you've been diagnosed with chronic kidney disease, you can still be managed by a family doctor. And we have their family medicine program with the University of Guyana and Georgetown Public Hospital that produces family doctors, and they have them at these health centers. You don't always need to be seen by a nephrologist in the early stages, because we can modify risk factors, those factors that I mentioned earlier. But what we need to know is that we need to utilize our primary healthcare system. We need people to go to the health centers and get their annual checkup. And once they are diagnosed with kidney disease, we need to say, okay, so this is what is happening. This is what you need to do to stop it. And this is what you need to do to ensure that your kidney lasts as long as it can without the need for dialysis and transport. When your kidney failure progresses, or your kidney dysfunction, I should say, progresses, there is the nephrology department at Georgetown Hospital. We offer dialysis there, and there is transplant as well. There is also dialysis in the private healthcare. So you have access to dialysis in the private and the public system as well. And then you also have access to transplant. And for now, we're only doing living donor transplant.
Yeah, we'll touch on that later on in the program. You spoke about COVID-19 and how the infection, once you're infected with COVID-19, how you're more at risk of getting your organs damaged, the kidney and the heart and so on. But you touch on the kidney specifically. In terms of the service that you provide as a nephrologist and in your department, how has the pandemic affected what you do?
The pandemic has been a good and a bad thing in many ways. And it has revolutionized healthcare forever. We will never go back to the way we practiced medicine pre-COVID. In terms of the bad things coming out of the pandemic, we're overworked, yes. We focus on our entire practice has changed. We care for our patients. We're worried when they get sick, are they going to live through this? We know that kidney disease patients are more at risk because they're more immunocompromised. They go on a dialysis machine, they're more at risk for infections. They have to go to a hospital to get dialysis, and so their encounters are more. In addition to that, our mental health has well taken a toll because we constantly have to worry, okay, when we go to work, are we exposed? Are we taking this home to our families as well? And so we are also constantly on strain. And it's for all our healthcare professionals, doctors, nurses, pharmacists, allied health workers. In addition to that, however, COVID has changed the way we do medicine. And the reason I am talking to you today from a different time zone in a different part of the world on live radio is because we can use Zoom now as a normal platform for everything, right?
Yes,
And
sure.
this is allowing me to do World Kidney Day activities in Guyana while I'm somewhere else.
Yeah.
And so this is the platform that we're using now for all of our meetings and for everything. And now we can study anywhere in the world and teach anywhere in the world and be a part of organizations and committees worldwide. We now have access because we now realize we don't have to travel for conferences and we don't have to travel for anything. We can sit in our offices and do medicine. We are doing all of our clinics, majority, say 90% of our clinics via telehealth now, where we call our patients and say, go to the lab and do this blood work. And we see the result and we call you and tell you what to do or what has changed and what has not changed. So we are doing telemedicine, we're doing telehealth, we're doing a lot more. And it has helped the patient because they don't have to take a day off from work to come to see us. They don't have to drive 3 and 4 hours. They don't have to have a family member absent from work as well to come to see us. So COVID has done many, many things for healthcare, good and bad, but it has shown us what we can learn out of it, what we can take into the future, and how we can revolutionize healthcare and meet the needs of the people in a simplified way.
In short, it has forced us to improvise and use whatever is available to us to push what we have. You touched on transplant earlier. We're going to talk about that in a few. But in terms of what is available, you mentioned living donor transplant. And I'm sure you know that we're pushing Guyana. There's a contingent at Georgetown Hospital who's pushing for legislation to cover organ donor transplant from the cadaveric or brain dead patients. Could you give me your thoughts on that?
Okay, and I'd like to commend the team at Georgetown Hospital, our transplant team being led by Dr. Kaieteur Prasad, who has been doing an excellent work in making transplant available for the Guyanese population. Every part of the world, we have living donor and deceased donor transplants. And so in Guyana, the reason we have not been having deceased donor transplant because we don't have the legislation, as you rightly said, to cover deceased donor transplant. And also we don't have certain infrastructures that are needed for deceased donor transplant. Living donor transplant is divided into living related donors where you can donate to a relative and then unrelated donors. And so far, like the culture in Guyana, we are not getting so many people to volunteer to be donors. And so if we don't have living donors, then our next option is deceased donors or cadaveric donors. And patients who may not have access to living donors, because if you're, for instance, if your whole family is diabetic or hypertensive, they can't donate to you, right? And so we need to have access to deceased donors. There are people who have really healthy kidneys who would have died from a motor vehicle accident who are quite young and otherwise have a perfect bill of health, and their kidneys can go and help to save somebody else. Dialysis is not the best option. Transplant is. Dialysis is just something that gets you through. Yeah. And so a transplant is definitive. It makes it is cheaper in the long run to do a transplant, and it will help the patient more.
Yes. In terms of your work, we know that a lot of people who are diagnosed with kidney disease, most of them go on dialysis, especially when they're at the end stage. And you know the expense that is attached to that. It's very expensive. What would you recommend in terms of helping to support those persons? Would you recommend, I don't know if the government has a system in place that helps persons with dialysis, or should it be something that comes out following consultation and so on?
The government does have a system in place that helps fund some of the dialysis. It is very expensive procedure. There are a lot of and there are a lot of resources that are poured into dialysis, and that's why it's not feasible in the long run. It's more feasible to do one, prevent kidney disease. Two, if you have kidney disease, to prevent it from progressing to failure. And if you know you're going to go to failure, this is one of the things I want to emphasize to our public. If you know that you have chronic kidney disease and you're at stage 3 to stage 4, and you're young and you will fail in your lifetime, like you will at the age of 40 or 50 or 60, you will have kidney failure, then think about a living donor transplant before dialysis. Okay, I am going to, the rate that I'm progressing, and that's why I talk about trends in numbers. If I see my kidney function is dropping 10% each year, I can say in 10 years time I may lose my kidney function. Do I have people that can donate a kidney? And the best option is to do a transplant before dialysis. And that is one of the things we need to tell the public out there, that this option is available to get people to say, okay, can you donate to me? Or work up the persons for a donation. And if we can promote and sensitize our public on living donor transplant, and it doesn't have to be a relative. A living unrelated donor can do just as much good. And a living kidney is better than a deceased kidney any day in terms of survival and function. So that's one of the things we can promote. We do have dialysis available, and the other thing we can do is that all of our patients who have kidney failure, we need to let them know their options. There are some people who might say dialysis is too much. I want to live until I pass, but I want to do it without being on dialysis, and we need to support that as well.
You are the vice chair of the Kidney Foundation of Guyana. Tell us a bit about what that foundation is, what you do, who's involved, your support system. Just give us a rundown.
Okay, so the Kidney Foundation of Guyana was established in 2010, nearly 11 years ago, and that was done by the Professor George Nicholson, who ended up opening the 5G Dialysis Center. And so that organization was formed to help patients with chronic kidney disease in terms of sensitization. We are a small organization. We do not have the financial capacity to finance like dialysis and transplant. We have been approached many times by patients to help them. But what we can do is we can advocate, and we can sensitize, and we can educate. And that's what we want to use our platform to do. I joined the Kidney Foundation about 7 years ago, and our chairman at that time was retired Major General Joe Singh, who is still our chairman. And our mission and aim is basically to sensitize the public, to collaborate with government and non-governmental organizations to reduce the impact of chronic kidney disease, and to support to prevent people from developing chronic kidney disease, and to advocate for those who develop chronic kidney disease so that they can live a good quality of life with their disease.
And in terms of your support system, who's backing you? I know some non-governmental organizations, they team up with a number of agencies. So who's backing your organization?
So at this point, pre-COVID, we were collaborating with the Chronic Disease Unit at the Ministry of Health, but then COVID happened. We had a change of government. We now have new people in the Ministry of Health that we're trying to collaborate with again. We had collaborated previously as well with the PAHO WHO. We now have access to the International Society of Nephrology and the International Pediatric Nephrology Association, which I'm a member of, and they have agreed as well. Because of COVID, finance and funding has been halted because we're in a pandemic. So there's no access to funding because funding has been prioritized at this point.
I understand.
We hope that through this, even with this forum, with these media broadcasts that we're doing this month, that we would be able to have the Chronic Disease Unit of the Ministry of Health to collaborate with them and be a part of this. We also will target like PAHO WHO. Part of their mandate and their sustainable developmental goal is kidney disease as well, to focus on kidney disease. And there are other NGOs out there who we have collaborated with previously. We're hoping to target the University of Guyana. to have the Faculty of Health Sciences come on board and have their medical students and their nursing students and their pharmacists and other allied health workers, even people in journalism. We don't just need medical people in the Kidney Foundation. On our current board right now, we have patients, we have transplant patients, we have dialysis patients, and we now have caregivers of these patients. And that's what I've been advocating for. We need to work as a team. Chronic kidney disease is not just for healthcare profession, it's for the people out there who are affected with kidney disease, and for their support staff to come and say, well, this is how we are affected, and this is what we think we need, and this is what we should focus on, and this is what the policymakers should focus on. And we want to come together with the media, with the families, with the Ministry of Health, the Ministry of Education. We want to start with the schools as well. And to work together.
In terms of your service, you touched on it a bit, but will you be offering financial support once you get going to persons who need dialysis? What is the support like? What are you offering?
So in terms of financial support, I will say no, we will not be offering financial support because it is not feasible. We do not have a revolving fund. So we rely on donations and fundraising. As you and I both know, dialysis is very expensive. And then how do we prioritize? If patient A comes and then patient B comes and patient C, how do we say, okay, who gets this funding? How do we say no to somebody who needs dialysis or they die? So it's something that we can't get into because we do not have a way of regulating it, and it's not sustainable for us right now. We think at this time, our best effort is to educate the public. It may not happen in my lifetime, but I hope with events like this and with educating the public in another lifetime, we may be able to halve our need for dialysis and transplant. And that is the goal, for us to be proactive and not to be reactive, not to spend all of our time and energy on dialysis because we will just be chasing our tails. We need to attack the problem at the source.
So you're basically a research and awareness-based foundation, and you will offer support wherever you can. We know that March 11th is World Kidney Day. Tell us about your activities, planned activities coming up.
Okay, so we celebrate a month of activities for World Kidney Day. Previously, we've had marches every year or walks, and we would have had like our private sector as being a big part of this, our Ministry of Health being a part of this. Because of COVID restrictions, we will not be holding any live events. We will not be doing any marches or any gatherings. And because of that, we will be using the media as one of our main platforms to deliver educational materials. We are hoping that we're going to be able we're going to use the print media as well. We're going to use our Facebook page and our website to deliver information. The other thing we're doing is we're hosting a series of medical education lectures that will be targeted not just doctors, but nurses and pharmacists. These lectures will be available to the medical professionals free of charge, and will be hosted by the Kidney Foundation of Guyana in collaboration with the University of Calgary, International Society of Nephrology, and International Pediatric Nephrology Association, where we'll be getting some of these materials and guest lectures from. And so these lectures will be, maybe we're doing about 6 to 8 in starting this month. And the public can be able to access this information. The access information will be broadcasted on our Facebook page closer to time.
In terms of persons who want to know more about kidney diseases and the whole aspect of treatment and so on, how can they, besides the Guyana Kidney Foundation, the Kidney Foundation of Guyana rather, how else can they find out more about the disease? Where else can they go to get access information?
If they have, there are many ways that you can have this information. You can talk to your doctor. A lot of the healthcare providers, a lot of the health centers would have access to this information. You can talk to your doctor and see what is out there. We have approached the chronic disease unit of the Ministry of Health to print materials for patients and for public educational materials, and we're hoping to get these printed and distributed to the public, to have them in health centers, to have them reach the hinterland areas. And we're going to work to have some of this material translated to native languages as well, so that we can target our indigenous peoples Other things that they can do, those who have access to technology and to the internet, there are many sites online, but we need to use reputable sites as well. We have the CDC, we have the kidney.org, we have the World Kidney Day Committee, we have our Facebook page and our website. And if you need personal assistance, we've had a lot of people message us through our Facebook page and we will respond to you. If you send us a message through Facebook Messenger, we will respond to you. We may not respond to you right away, but we will. And if you need information, we will provide that directly to you as well through our Facebook Messenger.
Also, well, folks, we have been hearing from Dr. Arifa Aladdin on kidney diseases this week, and we have actually at the end of our program. Dr. Aladdin, we want to thank you for taking time out from your studies and whatever you're involved in at the moment. We know that your time is very precious to you as a doctor. To tell us more about kidney diseases and chronic kidney diseases, we just want to say thank you so much for sharing with us. And we want to thank those who tuned in to the program this week. And we hope that you learned something, you would have taken something away from what we had to say, and we hope to see you at our next session every Monday for your health matters. Thank you and stay safe. Goodbye.
Thank you for having me.